Welcome to the just-in-time training for staff at Point of Dispensing clinics. This training will provide an overview on pods, jobs at the pod, incident command structure, and examples of job action sheets. Please see your supervisor if you have any questions after you review this presentation. Once you complete this training, remember to sign off and include the date within the MDA pod plan. Thanks. Enjoy the show. Okay, so what is a pod? Well, a pod, or point of dispensing, is a location that is set up to provide the public with medication or countermeasures to prevent them from becoming ill. An example of when a pod might be set up would be for anthrax or pandemic influenza. For our purposes, we'll use the anthrax scenario. Point of dispensing clinics will be open when there is an identified need and will remain open until the entire population at risk is prophylaxed. For the city's Readiness Initiative, or CRI, the goal is to prophylax everyone in the affected area within 48 hours. This is your mission. Pods will be highly charged with determination, fear, concern, and hopefulness. The volunteers who are working in these clinics are expected to remain calm and confident while on duty. All personnel will be educated on their role prior to the beginning of their shift. The charge for public health professionals is to do the greatest good for the greatest amount of people. A pod will allow us to accomplish this charge by providing pills to people in a short period of time. If an anthrax attack occurred, a public health emergency declaration would be made by the governor, thus allowing a pod to be stood up. So who staffs a pod? Well, pods are usually staffed with the following individuals: local health department staff, volunteers from community emergency response teams, or CERT groups, medical reserve corps, and other volunteers from the community. A caveat needs to be explained, however, about the medical professionals working at the pod. Only licensed personnel such as physicians, physician assistants, advanced practice registered nurses, and pharmacists can dispense medications during the pod. Nurses are not allowed to dispense medication. Additional scope of practice can be located within the FERA, or the Public Health Emergency Response Act. The jobs required to run a pod are many and varied. Therefore, everyone has the potential to contribute strength and resources in times of emergency. Volunteers can provide essential services both in a medical and non-medical capacity. Professional public health staff will be present to provide the expertise and skills to support clinic functions. People will be matched as best as possible to jobs they normally do. For example, a pharmacist will likely fill a role at the dispensing station. No one will be asked to fill a role they are not qualified for. This slide provides the basic organizational structure within a pod. It is very important for all staff to understand what the command structure at a pod looks like. Each pod in Connecticut will be organized using the incident command structure. Generally, the incident command structure begins with the incident commander. The IC is responsible for all activities and functions at the pod. They assess need for staff, establish incident objectives, and direct staff to develop the incident action plans. The safety officer advises the incident commander on incident safety. They work with the operations section to ensure the safety of personnel and patients. The information officer, or the PIO, advises the incident commander on information dissemination and media relations. They obtain information from and provides information to the planning section, the community, and the media. The liaison officer assists the incident commander by serving as the point of contact for agency representatives who are helping to support the operation. They provide briefings and answer questions for the supporting agencies. The operations section conducts the tactical operations to meet the objectives, and in this case, getting pills to people in a short period of time. The logistics section provides support, resources, and services to meet the operational objectives. The planning section prepares and documents the incident action plan to accomplish the objectives. They also evaluate the information that comes back to them. And lastly, the finance and administration section provides accounting, procurement, time recording, and cost analysis. As we talked about earlier, the goal of the pod is to get pills to people within 48 hours. This task requires a very large workforce. Thus, it makes sense to have volunteers or workers staff the pod for 12-hour shifts. This way, the number of people needed to fill the jobs decreases dramatically. You will all receive breaks throughout your shifts, so please don't worry. We breezed through ICS a few minutes ago, but here's a better description for you. Emergencies are managed under something called the Incident Command Structure. This structure was developed under the Fire Service and has proven effectiveness in managing large-scale incidents and the people necessary to respond. Of key importance to you are knowing the chain of command, or knowing who you have to report to, and the use of common, jargonless terminology. This slide shows you the 8 elements within ICS. Now on to the functional responsibilities within ICS. Here's a quick review. Command staff are a person or persons who oversee the entire operation. The operations section are in charge of direct tactical actions. They are the doers. Planning section prepares the action plans and maintains resource and situation status updates. Logistics provides support. The finance and administration section are responsible for cost accounting and procurement. Most of you will fill roles within the operations section. Here's an example of what a pod diagram might look like. Please take a minute to familiarize yourself with the layout. We shared earlier a basic organizational structure at a pod. Well, here is an example of the whole clinic organizational chart. The great thing about ICS is that it's scalable to fit your clinic's needs. Thus, not all clinics will be this large or have this many people filling roles. This diagram is just to inform you of what the entire organizational chart looks like. I know it's hard to read, but paper copies are available. Now on to some job examples. Job action sheets are given to all workers as they arrive at the pod. People are matched as best as possible to a job that they normally do. Job action sheets help to describe the duties and the responsibilities for each worker. Here's an example of one of the many job action sheets that you guys have. You'll notice that the major components of this job action sheet include the mission and responsibilities, the equipment needed, and the tasks. So what you need to do at the beginning of your shift, during, and at the end of your shift. Most roles are very focused on a specific task. I realize that not all of you know what jobs you will fill during the pod operation, and as a result of this, just-in-time training is essential in educating all staff and volunteers of what the situation is, why they were called here, how long the event will likely last, and how they can best be used. Once the volunteer or staff member is briefed on the situation, they will receive reinforced training on incident command and the organizational structure that ensues. Lastly, the volunteers will be sent to their station and told who their supervisor is. The supervisor will then give a more detailed briefing on the specific jobs and duties that are required. Here are some of the basics to just-in-time training, and perhaps the most important piece of information you should take out of the training is to remember the check-in and check-out procedures for each shift. This is very important. You will also need to receive your job action sheet and any additional just-in-time training. And lastly, know who you report to. The section chiefs are described briefly over the next few slides. They all report to the incident commander or the pod manager. The operations section chief, or OSC, will likely wear a red vest. The OSC oversees a very large group of individuals. You will notice that there are more unit leaders in this section because the span of control that a supervisor can have is up to 7 workers. So, it is likely that the OSC will oversee the branch chiefs for the medical unit and the non-medical unit. And then the branch chiefs will then oversee the unit leaders below them. The roles listed on this slide are just a few of the roles that will be filled within the operations section. Please note that there may be other jobs reporting to the operations section that are not listed here. The logistics section chief, or the LSC, comes next. They will likely be wearing a yellow vest, and some of the roles that will fall under the logistics section are listed on this slide. Again, please note that there may be other jobs reporting to the logistics section that are not listed here. Most often, the planning section chief, or the PSC, will be wearing a blue vest. The PSC will supervise the resources unit, situation unit, and the documentation unit. And based on any information that the PSC receives, such as flow pattern problems or bottlenecks, he or she may make changes to the operation of the pod in order to enhance throughput. Lastly, please note that there may be other jobs that report to this planning section that are not listed on this slide. The Finance and Administration section chief is the last section we'll be discussing. They will have a green vest, and the units that the Finance and Admin section chief will oversee include the cost unit, procurement unit, time unit, and the compensation and claims unit. Again, please note that there may be other jobs that report to the Finance and Admin section that are not listed on the slide. Congratulations! You've reached the end! I would just encourage you all to remember the following 3 things. Remember to follow the ICS reporting structure, ask questions, and remember, you're doing a great service to the public. So thank you a million times. Thank you, thank you, thank you.